Most pregnancies go according to plan,
There's your baby.
but some don't.
Cokers times 2, please. The worst case scenario would be fetal death.
When things go wrong, emotions get pushed to the brink.
It was really scary. I cried a lot.
And life and death decisions must be made in an instant.
If it'll save both the baby's life and my life, then we gotta do what we gotta do.
When time, medicine, and human health are pushed to the limit,
Right there, too.
it becomes a special delivery.
Okay. March 4th.
34-year-old Frederria Grandi is just 28 weeks pregnant, a full 3 months from her delivery date. But 9 days ago, she was admitted to Mercy Medical Center in Baltimore with preterm labor, dangerously early for her fetus.
The head is not down.
Then things got worse. Frederria started showing signs of kidney problems.
Her potassium had jumped up into critically high levels. When your potassium is too high, basically you're at risk of your heart going into cardiac arrest.
Medication stabilized Frederica's potassium levels, but there is still another serious concern. Frederria is diabetic.
The diabetes alone is a fairly significant complication of pregnancy because lack of control before you conceive will increase the likelihood that you have a baby born with defects, most commonly heart defects.
We got all the anatomy down, so there's nothing to suspect there's a problem there. These are the eyes. We got a nose, and we got lips. Got a little pudgy nose. She's got your nose.
And you can see all that already.
I can, I promise.
Now we're dealing with one complication after another. As soon as they get one straight, something else goes off balance.
All right, I think I spoke a little bit too soon.
Frederica's had 2 prior premature babies. In both cases, she suffered severe high blood pressure, called preeclampsia.
I'm gonna come back to this. I thought the blood flow looked good, but then...
Compromised blood flow to the placenta means Frederia is again suffering from preeclampsia. This is bad news for her fetus.
The best way I can describe it is a placenta having a stroke. Not the baby, but the placenta. I mean, there's areas where, see this dark area right here? The worst case scenario in Frederica's case would be fetal death. These are things that I can tolerate for the moment, but won't be tolerating for a long period of time. We'll be watching, and if I see anything that looks like it's going too far downhill, we can get you delivered.
It's very emotional, and it's just a matter of staying calm because I don't want to complicate anything any worse. And I want the baby to be healthy.
If Frederica's condition worsens, she'll be rushed into an emergency delivery.
$136, so it's a little higher than it has been.
Monica Martin is 31. 4 months into her pregnancy, she developed diabetes.
If my diabetes is too high, I feel really fatigued and tired and just really restless. And if it gets low, then I feel real shaky and weak.
Not good. So what I want to do is come in and hit this pocket right here. I want to avoid that umbilical cord right there.
I'm frightened of needles.
She doesn't like needles. Just relax, my dear.
Monica's diabetes is a pregnancy-induced type that usually disappears after delivery.
You're gonna be fine. You're gonna feel a poke, okay?
But it can cause serious problems.
In diabetics in particular, when their babies are large, they have an increased risk of shoulder dystocia. And that basically is a phenomenon where the head is delivered easily, but the shoulders and the rest of the body have difficulty being delivered. and so that can be a pretty significant obstetrical emergency.
Okay.
Monica's 37-week-old fetus is larger than normal, most likely a result of her diabetes. The sooner she can be delivered, the better. But that carries other risks.
There's an increased likelihood that this baby's lungs will not be mature because diabetic babies' lungs tend to lag behind in terms of lung maturity. During the whole procedure, big thing is to keep the needle stable, avoid the baby.
Monica's amniotic fluid will be tested for fetal lung maturity. The results will help her doctor make a decision.
Finish as soon as possible, that's it.
We're done. You did great.
My biggest concern is that the baby doesn't get too big, you know, that he matures healthy and, you know, everything just goes well with the pregnancy.
If you have any bleeding or really significant pain, then you need to give me a call.
Okay.
If the lab results are positive, Monica will be induced in 3 days. If not, her doctor will have to weigh the risks of waiting.
You can start having some contractions and you might get your wish anyway, even though we're not ready necessarily to get you delivered. We may get your wish. Alrighty, so what we're gonna do is I'm gonna look and see what this cyst area looks like on the bowel.
When Joanne Matos was 6 months pregnant, a routine sonogram detected an abnormality.
It looked characteristic of what we call a double bubble.
Doctors think her baby has a rare malformation of the bowel, a blockage that, left untreated, can quickly turn into a critical condition.
It was really scary. I cried a lot, and it's just, you know, you just don't know. I mean, all 3 pregnancies, my first, 3 babies, they were like, everything was fine. And then found out that something might be wrong with my 4th baby.
Some babies born with the condition require immediate surgery. 25% of them will have Down syndrome.
How's she moving?
A lot.
You having any contractions yet?
Yeah. It's worrying not to know what the baby have, and it's also sad that if the baby does come up with something that has to stay in the hospital, going home without your baby, it's just sad.
Joanne will be induced tomorrow, so doctors can treat her baby's bowel condition before it turns dangerous.
If anybody tells you childbirth doesn't hurt, they're lying.
1 hour ago, Tiffany Mangini was admitted to Mercy Medical Center to be induced. Her baby is very large, which could make the delivery very difficult.
The worst case scenario is we have a shoulder dystocia, and that is basically an obstetrical emergency where the head is delivered fairly easily and the shoulders are basically stuck on the pubic bone.
So you know you're going to get some good sleep right now.
Oh, yes.
Okay.
Oh, yes. Told you were my hero, right? I knew I liked you.
Until the anesthesiologist comes in.
Oh, well, then it's no holds barred. I'm sorry, I'm a fickle woman.
We don't want to give you the epidural too early because if we give it too early, we may slow down your labor, right?
Right now, Tiffany's pain is becoming increasingly worse.
It's gonna get worse before it gets better.
But her biggest worry is for her baby. Early in the pregnancy, her doctors made a disturbing discovery.
We were pregnant with twins originally, and at 7 to 7.5 weeks, they found that the fraternal twin had stopped developing.
When she had the sonogram done, one baby had regressed to 8 weeks. The other one essentially stopped growing at about 6 weeks and was reabsorbed.
When we realized we had lost a twin, we were very nervous about the health and well-being of this child.
Hello. So you got a little uncomfortable, huh? Okay, did the Demerol help? Okay, a little spaced out, a little sedated.
Most times, the so-called vanishing twin does not affect the remaining fetus. But with a difficult delivery ahead of her, any added risk frays Tiffany's nerves.
All right, you're gonna get a little poke. You got a good anesthesiologist, you'll be all right. Trust me.
Yeah, that's what y'all said about these IVs.
2 days after an ultrasound revealed problems with blood flow to her baby, Fredericka's already shaky health gets worse.
Basically, her liver enzymes have gone up substantially, and we look at the liver enzymes going up as an indicator that the liver may rupture. Yeah, it's all good. I know. It's just a little bit. Just breathe, okay?
It's really hard. Trying to be strong, and there's an emotional side. I'm just gonna. Some things you just have to grin and bear. You know, you grit your teeth and you dig in.
Frederrica's unborn child also has problems. At 10 weeks premature, it will be threatened by several health issues.
Yeah, you're doing fine. He's almost done, honey. Yeah.
Babies that are severely premature really don't have the lung function that we would like to see, and they suffer from respiratory distress. So intracranial hemorrhage and respiratory distress are the big issues that we're going to be concerned about in a 29-weeker.
If either Frederrica or her baby's health takes a downward turn, the delivery will immediately become a life-threatening emergency.
Come on, let's go, let's roll, let's roll. That's it.
Sylvie Carey is about to deliver. She arrived at Mercy 3 hours ago, already 6 centimeters dilated.
Can I get you to open up these gloves right here?
1 hour later, her water broke. When doctors saw green material called McConium, they knew they had a problem.
McConium is actually where the baby actually has a bowel movement inside the water. And what happens is it's in the amniotic fluid, and the babies are swallowing that and ingesting that and inhaling that. And so that's why we become concerned about meconium aspiration.
The delivery progressed so quickly, a pediatric team barely made it to her bedside.
The baby's out! He's out! My baby!
Well, you decided that he was coming.
My baby! My baby.
Fortunately, all initial signs are good.
She came out very vigorous and crying and was pink very quickly, so we really didn't have to do any resuscitation at all.
Congratulations.
Thank you. Hey.
Sylvie and her husband Alfred, both from Zaire, Africa, are relieved and ecstatic.
We call her Lucy Amini. That means I believe in Swahili. And it's funny how she looks quiet and alert at the same time. She keeps looking around.
Baby Amini will be thoroughly examined. If she inhaled even a small amount of merconium, she could develop a serious infection.
Lucy Amini.
You feel like the baby's coming down at all?
Yes.
3 days after tests revealed that her baby's lungs are healthy, Monica Martin is being induced. But there's a problem.
You're a good 4 centimeters, though, but that head is way up there.
The baby's head is above the cervix. That means the umbilical cord could drop below the head. If that happens, the baby's life will be threatened.
Once the membranes rupture and the cord comes down and the head compresses on it, it's basically like cutting off the blood supply to the baby. That means that the baby could die. The baby will die if we don't get the baby out.
To avoid an emergency, Monica's doctors will have to manually rupture her membranes.
Okay, this is the deal. We're going to give her an epidural.
Blood pressure is good, 110/56 right now.
First, Monica gets an epidural.
Okay, cold soak 3 times. I'm going in with the bigger needle now. Okay. There you go, chin to your chest. Don't move right now, okay?
But something is wrong.
She's in pain from her contractions, and with the needle going in, if I'm hitting the bone for some reason, I'm off the midline, then she will be in pain.
I don't think I can do this.
If breaking Monica's membranes doesn't move the baby's head into a safe position, she will have an emergency delivery.
Now, Joanne, you're going to notice that your contractions are going to come on a little bit more strongly.
Joanne Matos is being induced to control possible complications. Her baby may have a serious intestinal blockage.
I'm worried that the baby might need surgery. We don't know what she might end up having, you know. But, well, you know, praying that it won't be nothing and everything will be fine.
Hello, Joanne. How are you doing?
Fine.
You ready to have this baby?
Yes, I am.
Okay. When the baby's head comes down a little bit more, we'll rupture your membranes, and that should really get things going.
Okay.
Okay. All right. Do you have any questions?
No.
Okay.
So now we're ready to roll.
Okay, so I'm gonna put another scalp electrode on because that one fell off. She had nice clear fluid. She's about 5 to 6 centimeters dilated, and I anticipate she should deliver soon. I'd say within the next hour or two. She's about 8 centimeters, so we'll get everything ready for delivery.
I'm feeling fine, just feeling the contractions with the epidural, but not as bad as before.
The delivery is a few hours away. Shortly after, doctors will determine if the baby has serious problems.
Head is coming down. That's why there's more pressure. You are 7 centimeters.
All right. Ooh. This is Selena Alexander's second pregnancy. So far, it's gone a lot better than the first.
I was having pain so badly that I could not walk sometimes. I was also having a problem with my irritable bowel syndrome at the same time, so I didn't work, I say about half the month because I was out with that.
I would expect you to deliver in the next 2 hours.
Selena's first delivery was difficult. The baby got stuck and had to be suctioned out. Dr. Hoffman knows. She was there.
Last time I did a vacuum, and you know, we don't like to try to assist someone with the delivery unless we really have to, so I'm hoping again that second baby, she'll be able to push the baby out without me having to help pull it out. Okay, I'm gonna give Dr. Copeman a page. Okay. We'll get her an epidural. Does she have enough fluids?
Yes.
Because her first baby was big, the chances are this one will be also. Despite the increased risk of another difficult delivery, Selena is bearing up well.
I'm not that worried. For one thing, I believe in God, and I feel that the baby's going to be all right. And if it isn't, then I'll deal with it.
With her faith and her husband's support, Selena is ready.
It's all good.
By 5 p.m., Fredericka's doctors have begun an emergency C-section delivery. The baby is coming 3 months early, and Fredericka is at risk for numerous complications.
Cokers times 2, please.
The outcome for both is anything but certain.
Fredericka, how you doing? Okay. All right. You're about to hear the sweet sounds of a little baby Joshua. All righty. Awesome. Outstanding. Oh, little Joshua declaring himself. Yeah. All right. There we go. That's a section. Section. Oh, he looks like a big boy to me.
Reach for a while.
Yeah, look at that.
He's crying. He doesn't need a ventilator. I wouldn't, you know, he may need one, depending on if he gets tired. But he's breathing, he's crying, he's doing it by himself.
At just over 2 pounds, baby Joshua appears to be doing well. But his mother's diabetes and his prematurity could have serious consequences.
Dad, you can come see him if you want. He looks wonderful. We're going up to the NICU, and then put a little IV in him, draw some blood work, and see where we are, see what kind of help he needs, and get an X-ray. See what's going on. We're gonna weigh him, see how much he weighs.
I'm glad we did surgery today, mainly because she was in a lot of danger, and I think she's still not completely out of the woods.
Like her baby, Fredericka will require careful monitoring. But given her fragile state, getting this far is a major victory. Tiffany has only dilated to 4 centimeters. Because her baby is so large, the doctor wants to speed up the process and get to delivery as soon as possible.
We'll use a little Amini hook to hook the membranes and break the bag of water. The baby looks good. The head even came down a little bit more after rupturing the membrane, so it's going to put a little bit more pressure on the cervix, which will help the cervix to efface and dilate. We'll go ahead and start her at 2 milli-international units.
Okay.
All right. Okay, bye-bye.
All is well until 9 p.m. when suddenly the baby's heartbeat drops from 140 to 90.
If the baby's having decelerations, it means that the baby's not getting well oxygenated. And you have 2 choices. Either you get the baby delivered quickly vaginally, or you proceed to cesarean section.
The medical team must spring into action to avoid a crisis. Monica's doctors are about to rupture her membranes. If successful, her baby will drop into a better position, avoiding an emergency delivery. If not,
if too much of the fluid comes out too quickly, then it could cause the baby to go into distress because the baby is getting squeezed by the uterine muscle and the placenta is not getting enough oxygen to the baby.
Hi, Monica. How are you feeling?
I'm going pretty good. The pain is hitting now.
Okay. Well, I paged anesthesia, and they should be up here in a few minutes.
What we have to do is called a needle amniotomy, where we put just teeny little holes in the membrane so the water slowly leaks out.
No, give me the needle too, because I gotta keep her in sterile as possible.
If everything goes how we planned, she'll come right back to this room. We have an IUPC.
though her doctors are hoping for the best, they'll perform the procedure in an operating room to be prepared for the worst.
I'm going to put in an intrauterine pressure catheter to monitor your contractions.
The membrane is carefully pierced, and amniotic fluid slowly leaks out.
Nice and clear. Baby's head is coming down nicely. Cervix is thinning out nicely, Monica. You're doing great.
The baby is now in a safer position for delivery. Next, Dr. Brown Holt attaches a heart monitor to the baby's scalp.
Monica, that's your baby's heartbeat. Right? Baby seems to be fine.
Within a few hours, Monica should be safely delivering a healthy baby boy.
Success!
You're fully dilated. It's all right here. Okay, well, can you push?
Selena Alexander is about to give birth.
And push down.
Only when the delivery actually begins will her doctor know if the baby's size is a problem.
There. Oh, that's it. Good, Selena. Come on, push. There you go. Here she comes. Here she comes. Here she comes. Keep pushing. Keep pushing. Keep pushing. Keep pushing. Okay. Blow it out one more time. The baby's right here. Come on. Deep breath in and push.
1, 2.
Deep breath in and big push. Here she comes. Okay. There you go. Look. She's a wiggly one.
The baby girl, Jasmine, is delivered without any difficulties.
I feel better that she's here now. I feel good. I have a baby girl.
She's beautiful.
All right. I'm real happy. My mother's here with me, and she is. Hi, Miss Jasmine. Hi, Miss Jasmine.
She was good size. I mean, she was bigger than the average baby, and she's, what, 2 weeks early. So had she gone another 2 weeks, she would have been over 9 pounds. That's a good sized baby, but she, you know, she does real well.
It's gonna hit me later, though. I'm not the kind of person that it hits me right away. I think about it later, and I'll start crying and thinking how such a blessing it is to have be even able to deliver a person into the world. That's your name, Jasmine.
Oh, she looked great.
Alfred Carey is excited. He's come to take his wife and 2-day-old baby, Amini, home. But when Amini's condition suddenly changes, so does the plan.
They noticed that the baby was running a high temperature, so they decided to do some blood tests to see if there is anything going on.
The highest temperature today was 100.6, which for a baby is considered to be not drastic, but it just bears watching.
They want to check if the baby is running any infection or if there is something going on.
If baby Amini's temperature doesn't go down by this evening, doctors will order a lumbar puncture to check the spinal fluid for signs of infection. The news is devastating.
Hi.
As the Careys struggle with the situation, they get more bad news.
I'm okay. Unfortunately, Dr. Perkins is saying that she can't authorize you to stay. So the baby would have to stay in the nursery.
And I can't even stay in the nursery?
Only until 10. So you would have to leave tonight.
It has to be around. If is there anybody that we can talk to, because there is no way that we can leave here and leave the baby here.
The sticking point is Sylvia's insurance policy. It will not pay to keep her in the hospital unless she's a patient.
I don't want to be a patient.
Right.
That's the thing. The insurance has nothing to do with that because I'm just going to be like a visitor.
A quick consultation with hospital staff results in a compromise.
The plan for Sylvie tonight is to stay until about midnight, and then she's going to come back at 3 a.m. and 6 a.m. to feed the baby. You can stay in the room until, midnight.
One crisis is averted, but another is threatening. The Careys can't imagine what is wrong with their baby.
What are you feeling right now, sweetie?
I'm feeling the contractions.
Feeling the contractions? Are you feeling pressure?
Joanne Matos is about to give birth. With her is the baby's father, her boyfriend Joel.
And when you have a contraction, we're going to have you take a deep breath and push down. And also I need the Foley out. Do you feel pressure? Grab behind your legs, take a deep breath and bear down. 2, 3, and here comes the baby.
Oh my God.
Yep. Keep pushing.
Already?
Baby's coming. Yep. Keep pushing. Push. Keep pushing. Keep pushing. Keep pushing. Baby's coming. We almost have the baby's head delivered. Take a deep breath and push down again, Joanne. Push. Keep pushing. Keep pushing. Keep pushing. Baby. Mama. It's a big baby, a little girl. Here she is.
Oh my God.
Here she is. She's a big girl. Okay. There's your baby. She's fat. Okay.
She's a beauty. First of all, she looks wonderful. She doesn't have any respiratory distress, or she's not having any trouble breathing. That's great. We'll do an X-ray of her belly at first to see what that looks like.
If the baby has the serious intestinal blockage detected earlier, she will require immediate surgery. But there is also some good news.
She doesn't have any of those facial features that are consistent with Down syndrome, so just by a quick examination, she doesn't look like she has Down syndrome, which would be associated with the duodenal atresia.
Once the baby is stabilized, she'll be x-rayed. Within half an hour, her doctors will have the results.
Tiny little artery that we're trying to stick a needle into, so.
In his first hour of life, baby Joshua is in guarded condition.
We're gonna give him a little extra oxygen, not much, because he's starting to tell us he needs a little bit, but that's okay.
The biggest concern is his lungs. His inability to take in enough oxygen has raised the acid level of his blood.
People who are, in fires or in situations where they're not able to get oxygen, they become acidotic. So that's basically what his clinical picture was beginning to show.
No, not that cart.
Joshua will be given medication to lower his acid level, and an x-ray of his lungs will determine their maturity. While Joshua is treated, Frederria is recovering from surgery.
It felt good hearing the sound of a crying baby. He did come out crying on his own. So it's a good feeling, and I was so glad it was over.
But doctors are still concerned about her liver enzymes, which were dangerously high before delivery, as well as her blood pressure.
The cure for preeclampsia is delivery. So we pretty much have done what we can do on that end. You just see his diaphragm moving, and he's just kind of like he's working a little hard to get air.
Let me just get this blood pressure.
He's still not out of the woods, because as you can see, he was kind of breathing hard and grunting, and he's showing signs that he's working at breathing. So I would not be surprised if they, before the end of the night, they intubate that baby.
The next 48 hours are critical for both Joshua and his mother.
Now, when you feel the contractions as pressure, when you feel that, that's when you want to do your pushing.
And let's go. Push. 2, 3.
There you go.
45 minutes after her membranes were ruptured, Monica's in advanced labor.
It's going to be a little work. I warned her to take her nap.
Her husband, Anthony, and their 4-year-old son, Anthony Jr., are here for support.
I'm really ready and happy about it.
And 2, 3, 4.
With her baby now positioned safely, the primary concern is whether or not Monica's diabetes will affect her baby.
Okay, I need a break.
If the baby's glucose is very low, it really could cause some potential problems in how the baby transitions from its intrauterine environment into the external environment. So we're gonna let the contraction build up a little bit more first, okay? So you're gonna have to stand it for a little bit.
Okay.
After 13 hours of labor, things aren't progressing as quickly as they should be.
Babies usually come with their face facing down to the floor. And this baby hadn't quite turned when she first started pushing. And my concern, and it's hard to feel now because it's so far down, but my concern is that it's coming, as we sometimes call sunny side up, with its face up.
That will delay the delivery, pushing an already tired Monica into exhaustion.
It smells like plastic and it smells like stuff, but there's nothing coming out of there but oxygen, all right?
Okay. 5, 6, 7, 8, 9. I just need a 7.5. I need a little lidocaine. Push. Harder.
6 hours later, the moment finally arrives.
Stop pushing. All right. Okay. Hear that, Monica?
Little Evan Martin appears healthy. His last hurdle is a blood test to reveal any ill effects from his mother's diabetes.
Mommy time.
Go ahead and push.
Hold the foot up here.
Oh, the head's right there. Okay, hold on, Tiffany, hold on. Baby's head is right there.
Tiffany Mangini's doctors have been worried that her large baby would complicate the delivery.
With another push, we're gonna have a baby.
But now, their bigger problem is a sudden and steep drop in the baby's heart rate.
The baby is in distress. It's like they don't have enough oxygen to pump around their body, so we have to get the baby out quickly.
At the moment of delivery, it's clear why the baby's heart rate was dropping.
We have a cord around the neck. Whoa! He looks great. There he is. He's a cute little guy. As she was having contractions, the cord was getting compressed because it was around the baby's neck. So as the baby was coming down into the birth canal, the cord was getting compressed and the baby's heart rate was dropping.
The crisis is over. Robert Leo Mangini is just under 7 pounds and healthy as can be.
I'm very happy. Very, very happy. I'm just glad to see him here and looking so good.
He's just wonderful.
Half an hour after her birth, Tiana Matos is stable. An X-ray will soon reveal the severity of her abdominal cyst.
I'm just a little scared, you know, of what the result might be.
Abs done up here. I'm concerned, yeah, I'm definitely concerned, because if there is significant duodenal atresia, the baby will need surgery.
The X-ray is inconclusive.
There's no air throughout the rest of the intestines, so that does make the suspicion of duodenal atresia still a possibility. So we'll go ahead and order the other tests, starting with the abdominal ultrasound. Knock, knock. Yeah. Okay. Well, unfortunately, I wish I could come to you and say, I have the answer, yes or no, but I don't know yet, okay? But I think there's still a strong possibility that she does have the blockage of the intestinal tract.
Despite the troubling prognosis, there is also some very good news.
We probably will send chromosomes on the baby to be sure that they are normal, but she doesn't look like she has Down syndrome. Okay? Okay, good. Well, congratulations, and as we know, we'll let you know.
Just when Joanne wants to hold her baby for the first time, she must instead wait while Tiana undergoes more tests.
It looks suspicious for duodenal atresia. She'll be transferred there tomorrow.
The morning after baby Amini became feverish, doctors are still trying to trace the cause. Their biggest concern is the possibility that it may signal a serious infection.
It could be very life-threatening because the baby has very, very small immunity at this point. That's something that develops in time.
She likes that finger.
I wish I was home peacefully, but also it could have been worse had we go home and not knowing that something was being done. So what can we do?
Amini must undergo a series of tests. The most difficult and painful procedure involves withdrawing spinal fluid. If Amini has an infection, it will likely show up there. The doctors carefully insert the needle into Amini's spine. Unable to extract any fluid and unwilling to put Amini through additional pain, the doctors stop trying.
Sometimes just due to the anatomy of the newborn baby, their small size, their vertebral column being very close together, sometimes it is a difficult procedure.
Amini is treated with antibiotics while her lab tests are being analyzed.
We're gonna survive. I think there are worse things that happens in life, so we are happy she's here.
In 24 hours, the tests will be in. Until then, it will be the longest 24 hours of Sylvie's life.
.50609. They match.
2 days after Jasmine's birth, Selena and Tommy Alexander are excitedly preparing to take their baby home.
I am glad to be going home. I am excited to leave. Like I said, to go home and really introduce it to the world.
It's my dream come true. Yeah, I'm glad that I have a daughter. I love my sons, but I've always wanted a daughter, so it's gonna be my sweetheart.
As the Alexanders start a new chapter in their lives, they are filled with joy and gratitude.
She's a blessing because I know every woman is not able to carry a baby. Every woman is not able to deliver a baby. Every woman cannot bring a life into the world, and that's a blessing.
You can see there's a hazy appearance to the lungs.
5 hours after his birth, baby Joshua's chest X-ray reveals a problem.
Then you have this generally hazy or ground glass appearance, which is a hallmark sign of respiratory distress or premature lungs.
If his lungs strengthen in the next 24 hours, he'll recover on his own. If not, he'll need intervention.
Well, his situation is probably still guarded, I would say.
The next morning, Frederria gets to hold her baby for the first time.
Yeah, look at that little nose. Oh. Hi, handsome. It's amazing. And I thank God that he's being taken care of the way he is, so I'm comfortable. You know, even though I wish he was bigger in size, and I wish that he didn't have all the tubes hooked up to him, but just looking at him, he's all right.
At the same time, Dr. Scholes Douglas is getting bad news about Frederria.
But unfortunately, her potassium, for reasons that we still can't completely explain, her potassium has increased again.
That means a return of the kidney problem that was endangering Fredericka's life before delivery.
And I think you're going to probably need some more extensive evaluation of your kidneys to really find out what's going on there.
It's a little bit overwhelming, but right now I'm taking one day at a time, one step at a time.
The next 24 hours are critical. Both mother and baby face life-threatening problems. Because his mother has diabetes, little Evan Martin must have his blood sugar tested immediately after his birth.
You just basically take a little needle and prick the heel of the foot and get a drop of blood, and the machine tells us what the baby's glucose level is.
Well, you get rest, okay?
Meanwhile, his mother is recovering from a difficult labor.
And you're going to be on your diabetic diet, but we'll do the sliding scale insulin. We will only give it to you if you need it.
I'm just glad it's over, and I have a bundle of joy now.
He had a slight temperature, like 99.5, so I'm going to call down to newborn nursery, and what we're possibly going to do is set him downstairs, just so they can watch him a little closer.
Evan's glucose level is at the high end of normal. He'll be monitored for the next few months.
Okay. Thank you. All right. So we're going to see something, in terms of diabetes. We wouldn't expect that till several months to years down the line in the baby.
Monica, however, is a different story.
Because she's had diabetes in both pregnancies, and because of the extent of the diabetes, I would expect that she's at a significant risk of getting it later on in life.
With a proper diet, Monica may prevent the onset of permanent diabetes. For now, she's grateful to have a healthy baby.
Yes. I'm excited about being a new mom again. My son is also excited. He loves him to death. He wants to hold him. He wants to feed him. And give him another kiss. So he's going to be a big help. But I'm excited. I'm just glad it's over. But please don't.
We're going to go through the turning part.
Baby Robert's second day of life is going well.
He is doing really great. He has started feeding much better, and he is very alert. He kept Mommy up most of the night, didn't you? Yes, you did.
The trauma at delivery had no long-term effects. Robert is healthy and ready to go.
I'm so excited to take him home finally. It seems like it's been forever. I know it's just been 2 days, but it's been the longest 2 days. We're ready for him.
Tiffany's husband and their 2 children are at home, excitedly waiting for the family's new addition. For Tiffany, this is one of the happiest times of her life.
I couldn't have asked for a better delivery of my pregnancy. I'm not going to complain ever. He came out healthy and beautiful, and we're going home now. It just doesn't get any better than that.
Less than 24 hours old, baby Tiana is being tested to determine the severity of her abdominal cyst.
And I'm just scanning here generally across the abdomen to take a quick look at the organs.
After inconclusive x-rays, doctors are hoping an ultrasound will be more revealing.
What I can see in this case is that in the spleen, there's 2 cysts in the spleen. These are developmental cysts. It's not going to cause any problem with the child.
That's good news. But Tiana has one more procedure to endure. Meanwhile, her mother is anxiously waiting.
Just a little worried. Just waiting for the results that, for the tests that they're gonna do and see what's going on.
Okay, Dr. Denker, we're set.
Come on, sweetheart.
Tiana drinks a compound that X-rays will follow through her system. If it passes, there's definitely no blockage.
There's the barium going through the esophagus now, and it's just going into the stomach.
8 minutes later, the test is completed.
That's good news. Look at that. Dead empty. So that's very good news. Good. Is Dr. Gonkari in there?
Tiana no longer faces major surgery and is now declared to be in perfect health.
Okay, yeah, you can come up now. It's just, you can't find the words to describe what you feel. I'm just happy that she's okay.
Tiana will need a follow-up exam in a few months, but just as a precaution. She and her mother will head home tomorrow, both happy and healthy. What a difference a day makes.
Her temperature has gone down. She has no fever. Her culture has been negative and are still negative, so she's not sick.
24 hours ago, baby Amini was being tested for infections. Today, she is as healthy a baby as any parent could hope for.
We're very excited. The house is ready for party.
For Alfred and Sylvie, they've been given the greatest gift possible, a healthy baby girl.
Howdy, howdy.
Howdy doody.
How you be doing?
Me be doing sore.
3 days after giving birth, Frederria finally gets the news she'd been hoping for.
When do I get to go home?
Well, it's looking good so far. Your blood pressure seems to be coming down slightly. Your liver enzymes are improving. Your platelets are stable. Your kidneys seem to be doing well, so...
Really?
Yeah.
Frederica's improved condition is good news, but she will need comprehensive follow-up care.
There's an underlying medical issue that we're concerned about. No, there's still possibly something else going on.
Joshua's lungs are strengthening, and medication has lowered his blood's acid level.
This is the way you would like it to go, I think. They're not ventilator dependent. He's breathing on his own. He's not getting any oxygen. He's doing pretty well.
You opened your eyes. I saw that. You playing peekaboo?
He looks beautiful. Every day that I see him, I realize how much of a blessing from God he is. It's going to be very hard leaving him here. I love you, Joshua. I'm not leaving my baby behind. I'm just disappearing for a moment and coming back to see him each and every day.
Frederria knows a difficult road lies ahead. But for now, she is confident her son is in capable hands.
I miss the old place.
6 mothers walked in these doors filled with uncertainty. Now, they are able to walk out filled with joy.